Hello, I'm so excited to share with you the Advanced Rejuvenating Concepts Microneedling pen and system. So before we get started, I just wanted to show you the pen. So this is what their pen looks like. It has an area to charge your pen, or if it's not charged, you can actually use the pen plugged in. It has an adjustable dial right here, which allows you to adjust the needle depth. So if you look on here, you can start at a 0.25 because in certain areas, you're just not going to want to go as deep. And you can take this pen all the way up to a 2.5. So you've got the area right here to adjust your depth of needle penetration. Then when you flip it over, what's really cool is you also have the speed control and power button. So when I turn it on, it starts on low speed, which is going to have fewer revelations. So you're going to have less needle wounds going in. And then the higher you go with speed, you're going to have more revelation. So you can adjust the speed as well as the depth to make it the perfect treatment for each client's skin's needs. And then to turn it off, you just hold the button and turn it right off. They've got a few different needles. They've got a 16 and an 11 that are very popular. And we're going to go ahead and get started with our microneedling treatment. I'm using Fruit Zyme Enzyme Cleanser. So we're doing a cleanse right now, and technically you would cleanse and then you would numb. This client had her own numbing cream, so she was using it prior to coming over. So I'm cleansing now, and then I'm going to double cleanse so that there's no numbing on the skin. And this way she will be nice and numb, but normally you would cleanse and then numb. A few benefits of microneedling on the skin. One, you're able to improve the skin tone and texture. So for clients looking to smooth out the surface of their skin, microneedling is great. It helps reduce the appearance of fine lines, decreases that appearance of surface pigmentation. It improves the skin plumpness, so the skin's going to look a lot more youthful afterwards. It also helps with circulation. It stimulates collagen and elastin, and it's really nice for people who want to work on some of those acne scars. So you can treat a lot of your clients with microneedling. And now the numbing cream is off, but I'm just going to do a cleanse just to make sure the skin is super clean. You do not want to microneedle with any cleanser or numbing cream on the skin. You want to make sure it's fresh and clean. Just a little bit more just to be safe. The Fruit Zyme Cleanser, a tiny bit, goes a really long way, which is nice. You always want to make sure when you're doing microneedling that your client has been prepared. You've done a complete consultation and evaluation. You want to look for a history of any type of fever blisters or cold sores. And if they do have a history, you want to make sure they're treating them prophylactically before they come in. You want to find out if they have any allergies, if they've had any reactions to skincare treatments. Nice thing about microneedling is while it does have a little bit of downtime, it really can yield noticeable results for your clients. So for clients looking for a more pronounced result, microneedling is the great way to go, especially if you're dealing with fine lines, wrinkles, mild acne scars. If they have a lot of pigmentation on their skin, you want to treat them prior with lightening agents, because we are creating a controlled injury on the skin. So what we have here is we have some sun damage, and the microneedling is going to help to reverse some of that. It's going to change some of the surface texture, which is really nice. The channels that we're creating today will be open for about 6 hours. So we've already talked about the post-care, and I'm going to be sending her home with some products. She's not going to want to touch her skin for at least 6 hours post-treatment, and then I'm going to give her some Rest and Restore that she's going to apply to her skin tonight, Tomorrow she can splash with tepid water and use the Rest and Restore. I'm also going to give her a little bit of the post-peel balm if she has any areas that are a little bit more tender. And she can use that in about 36, maybe 48 hours. She can start to go back to a skincare routine. So what we're going to be using is the Rest and Restore, which is a hyaluronic acid gel. And I personally prefer using hyaluronic acid when I do microneedling over other ingredients. There are things people use. My preference is always hyaluronic. It's my go-to. So we're using an 11 needle cartridge. Advanced Rejuvenating Concepts has different size needles, or I should say different number of needles. I think they have a 16, they have an 11, and I believe they have a 36. So I'm going to go ahead and get my hyaluronic here. You still feel really numb, right? Mm-hmm. Okay. The most tender area is often around the forehead because there's no meat here. It's kind of straight to the bone. So we're going to start on a little bit fattier area. The pen looks like this, and you have different speeds. So oftentimes the first pass can be done on 1. And she is a little bit more on the sensitive side, so I don't know if we're going to be going to really high speeds that we might do on a more resilient skin. So the cartridge is sterile. I'm going to go ahead and take the protective cap off. Turn a little to your left, right there. And you basically just put a little bit of the hyaluronic. You okay? Mm-hmm. Okay. Oh, she's a good one. You can do it circular motions, and we're only on 1. Some people will do striping. And you can also do tapping. And I think for her skin, the best approach is going to be tapping. Turn a little more to your left. There you go. And my hunch is we're probably only going to do 1 pass on a low speed because she's more sensitive. And a little bit of pinpoint bleeding is fine. Can you feel any of it yet?
I can feel it, but it doesn't hurt.
That's what we want to hear. Turn a little more to your left so I can get a nice flat surface. And if your skin's getting if your glove's getting a little wet from the hyaluronic, you can just put some gauze here and pull. As far as needle depth goes, so when you're thinking about what you're going to set your pen to, it really depends on what part of the skin or on the face that you are working. So for example, if you're working on the forehead, you're going to go a little bit, you're going to turn the dial down just a little bit. So a 0.25 to a 0.5 is typically where you fall, unless they have very thick skin. If they have thick skin, you may go from a 0.5 to a 0.75, but on the forehead, because there's less meat there, you tend to dial that down and do about a 0.25 to 0.5. When you're looking at a thicker area, the cheek area, where there's a little bit more meat, or some of the chin area, you might be at a 0.5 to a 1.0. It really depends on the thickness of the client's skin, depends on the results that they're looking for, and it depends on what your series or protocol is going to look like. Advanced Rejuvenating Concepts has a chart that you can look at to kind of give you a starting point when working with microneedling depth. You can see she's getting rosy right where we're doing it, and that's what you're looking for. You're looking for a flushing. You can do it in circles. I see a lot of technicians doing circular motions. I see a lot of technicians going in lines. And you can also, actually I like to do a combination. So in some areas I might do circles, and in other areas I might kind of press. And the nice thing about this pen is not only can you work on the speed, but you can also work on the depth. So as you get closer to the thinner area up here, I'm going to dial the pen down to maybe a 0.5, because it's going to be a much thinner skin there than it is going to be on the meatier areas. As far as frequency goes, If you are looking for collagen stimulation, so you're doing microneedling treatments to enhance the collagen production, you want to do about 3 to 5 sessions, and you want to spread them in about 3 to 4 week intervals. So when a person comes in and they're asking for that collagen induction therapy, you want to make sure that they know they're going to have a series of treatments and you're going to do them on a set schedule. If someone is looking to work a little bit more aggressively on, let's say, stretch marks or deep wrinkles, they're going to possibly have to have 5 sessions, 4 to 5 sessions, maybe 6 sessions. Those can be anywhere between 2 to 4 and up to 6 weeks apart, depending on how aggressive you are with the microneedling. If someone is looking to fix scars, they're most likely going to have 3 to 6 sessions, and they're going to schedule them in about 3 to 6 week intervals. Nothing like a good numbing cream. This area is a little bit meatier. I want to make sure I do there. Good. Okay, turn a little bit to your, there you go. Just a little bit of pinpoint bleeding is actually perfect. That's exactly what I like to see, right there. Perfect. Another one of my favorite treatments. Not for everybody, but boy, is it nice for results. Oftentimes the client will just kind of have like a sunburn feel. When you're microneedled and you create these micro channels on the skin, you are going to have some transepidermal water loss. So the skin often feels very tight and very dry afterwards, and that's 100% normal. So as I had mentioned earlier, I don't want her touching her face for at least 6 hours because those channels are open and we're just putting hyaluronic on there. But once those have closed up, she still will have lost a lot of surface moisture and her skin's going to feel tight, dry, a little sunburned. You're pinpointing, but it looks good. You're more resilient than I give you credit for. A little more this way, on top. Look up here a little bit. Now I'm going to turn it down to get under the eye area. And so I can also move up onto the forehead. I'll do right under the eye. So I've turned it down to a 0.5 so I can get right under here. And I do like to pull the skin a little bit when I'm here. Turn to left, and I'm going to pull a little bit. I know. We probably only do one pass here, but it's one you'll like. They will feel this one a little bit more. You hanging in there? Mm-hmm. Okay. But I love doing it right here. When I do it myself, this is like my favorite area to really get in nice. Okay, and now I'm gonna go here. Turn a little bit to your, there you go. doesn't feel good. Sometimes that makes people feel like they have to sneeze, but I hate to do the face and not do the nose. I just feel like you need it, you know? That's exactly what you're looking for right there. A little bit of pinpoint bleeding is perfect. I'm going to do on the forehead, and I'm going to keep it on the 0.5 because this is a thinner area. Oftentimes the client will feel it a little more here, and so you don't want to go you don't want to go too deep in this area. So again, you can cross hatch. I see a lot of people that do this. I see circles. Again, everybody has their own technique. There's stamping. I like to do a little bit of everything. Just kind of depends on what the area of the face needs. But this is for me, this is what I'm looking for when I microneedle, which is this little bit of flushing that you see. And we see the pinpoint bleeding, which is exactly what we want. You know? We know we're being effective. I'm not going to do a second coat here. Pass, I keep saying coat like I'm doing a peel. You can tell I'm a peel person. This is exactly what I'm looking for. Your skin's behaving, my dear. How's that sound?
Great.
Oh, you like that? Skin doesn't always behave, and yours is behaving exactly how it's giving me what I want. Now you're making me want to give myself a microneedling treatment. Of course, you're numb, so you're not flinching, and that would make it another reason why it looks great. You can microneedle somebody without numbing. I've done it on myself, not numbed. I've done it on people, not numbed. It's just more comfortable if they're numb. And it's definitely more comfortable if you're going to be doing any depths that are more corrective. You know, we're really not going crazy deep on these, but we're creating a controlled wound, basically. It's an injury. It's called collagen induction therapy. It's called CIT. So as we injure the skin, it's going to repair itself and rebuild collagen. So now what I'm going to do, we've done one pass. I'm going to take this up a little bit faster, not the depth, but the speed. And I'm going to do her cheeks. I'm going to go back to where I was. Okay, just there. And then I'm going to get her cheeks to flush, like I got her chin and her forehead too. I'm going to get some tightening in here. Now she has taken antivirals prophylactically, so I am avoiding her lip area right here. Even though she's taking prophylactics, I don't want to irritate that area. So I'm just going to do these in areas where we need a little more. Oh, your skin is doing what I want. Look at that nice pinkness, guys. Isn't that good? So I've moved up the RPMs. So we turned up the speed a little bit. So that means there's just getting a little bit more revelations. No depth change, just a little bit more revelations. And I'm going to work on the areas that are a little denser. A little bit more channels here. We'll get a little bit more tightening here. I'm trying to get a universal, kind of an overall looking nice flush with small amounts of pinpoint is what I'm looking for. Not all microneedling has to be a bloody mess. I mean, it can go deep. If you're doing more corrective work, somebody's coming in for acne scars or deeper lines and wrinkles, you could go for a little bit more corrective microneedling treatment. But just because you have the ability to hit something really hard with a hammer doesn't mean you should hit everything really hard with a hammer. And not everything needs to be banged with a hammer. So it's really important that you don't overtreat. And and it's walking that fine line between making sure they get the right treatment they need. And as you can tell, she's starting to get nice and even. The rosiness, the pinpoint bleeding is evening out nicely. Under here. A little tighter under here. I've got a good amount of the HA on here, so it's wonderful glide. Love. This Rest and Restore is what she's going to take home with her. Turn a little bit this way. Areas. The Rest and Restore Hyaluronic Gel is one of my favorite products, regardless of microneedling or not. I just love it as a hydrator. So as far as the phases of recovery go, the very first phase, which you see right now, is the inflammatory phase. And this is where the client or the patient is going to have some skin inflammation. This is because of the wounding of the superficial layers that we have done with the microneedling process. This activates the macrophages, and that activates other responsive cells. So we've kind of started that wound cascade. The next phase, which she's going to move into next, is the proliferation stage. And this is where the epithelial cells are going to start to close. The wound is going to start to heal, and fibroblasts are going to create new collagen. The last stage is the remodeling stage, and this is where growth factors and fibroblasts, they're going to create new tissue and they're going to organize new collagen. So it's a process. It's not an immediate result, but over the next days and week and a half to 2 weeks, your client is going to be going through these different phases. And I dialed it back down to a shorter depth just to get up in here because, as I mentioned earlier, there's not a lot of meat here. And you always want to make sure you get your treatment done before the numbing wears off, if you can, if they're numbed. She's being a rock star, by the way. Just want to share that. Most people are not this still, so I assume she's super numb, which is great. All right, looks nice and uniform, doesn't it? Nice and rosy. Mm-hmm. I like that. I don't like it. All right. Okay, so what I'm going to do is I'm just going to, any of the HA that I still have, I'm just going to put that on. I don't want to put any creams or lotions or anything on right now. I don't want to put SPF on. I want to just put the HA on. I'm going to send her home with this HA, and she's going to apply this maybe once or twice tonight before she goes to bed. Tomorrow she will, splash with tepid water, pat, and then apply some of the HA. And I don't think she'll need it, but I'm still going to send her with some post-peel balm in case there's any areas that, she feels are a little more tender. And what's happening now is her skin is going to respond to this injury by producing more collagen. We're kind of kick-starting the skin. It's going to start producing the collagen, plumping up her skin, smoothing out her lines. And I would say within 48 hours, she could probably go back to her skincare-ish. But you see the best results from microneedling about 3 to 4 weeks afterwards. And if she was doing a series, I would probably wait about 4 weeks to do the next treatment so that her skin can cycle through. And I would do maybe 2 to 3 microneedling treatments over a period of 3.5 months for maximum results. Also having her on products in between that are going to encourage cellular turnover and exfoliation as well. A few post-care tips for your client. So post-treatment, for the next 24 to 48 hours, we really are just going to have her treat her skin with the Rest and Restore, which is going to help hydrate the skin. It's going to improve her comfort level. We want her to avoid sun exposure, any type of steam or a sauna, or I don't want her working out, running a marathon, anything like that. Don't want her picking her skin, pulling at her skin, scratching at her skin. I'm going to ask her not to use her retinols or exfoliating products that she has at home or any hair removal creams whatsoever. And also it's important to ask them not to color their hair or do any chemical hair care services, at least for the next 48 hours while that skin is coming out of that inflammatory phase.